some every day, I know your mommy healing. Pejami tisha bim, ejama bawa nim, kiemi. Saya, rabba tene mana wantu, gara, rabba pepa meri miso, try. Victory we be feeling in my soul, so I fight on. Fight on, it's in the rearview mirror, ready where my eyes on. Run through the storm, Mad Max, I did ride on. Pejami cry the shower size, I'm in comfort. Pejami tell me so fresh. Just finish.
Medidi yanyante chwa maybe am discover for Europe akoma busuafo for Ghana no me use Taptap Send no fee mobile money transfer easy convenient fast and sounds so free won't you hwe me discover ye mapim Taptap Send entienne also download the Taptap Send app no ewo mobile phone so free na fesika komo abusuafo for Ghana afa na nyina Taptap Send papa no a bank that supports you, a bank that cares for you.
Every day, Ghanaians abroad and individuals in the diaspora are shaping their future, whether it's opening an account to save for an upcoming visit or a potential return home, supporting loved ones back in Ghana, managing investments, or building businesses. They are laying the foundation for a better tomorrow. But for all of this to happen smoothly, they need a trusted financial partner.
And that's where we come in. We've consolidated Bank Ghana's diaspora banking solution, making banking effortless for Ghanaians and diasporas worldwide. From opening and managing accounts from anywhere in the world to accessing investment opportunities and seamless banking services, everything is just a tap away on our mobile app, internet banking, and other digital channels.
Are you a Ghanaian living abroad or a diasporan? We have the right financial solutions designed for you. From opening and managing your account, regardless of where you live, to building a business or planning your return to Ghana, we are here to work together to create a lasting impact, both for you and for generations to come.
Reach out to us at diaspora@cbg.com.gh for any assistance or support.
We stand with you.
My name is Abena, Lady Abena, and together with Lady Baba, we will be your hosts for today. Our guest speaker, who will come on later on, goes by the name Dr. Kordzo. I know a lot of you know him, and he's been missing in action for a long time, so we're happy to have him here. But before we bring him on, just like to say that the show is sponsored by Taptap Send. Like, share, and use. Okay, so Dr. Kordzo is going to talk to us about cervical cancer. Now, cervical screening saves lives, yet it is one of the topics where either we don't know much about or we are scared to attend, and a lot of us do not attend. And it's something that cervical cancer is actually something that we can actually, if found early, treat or prevent all in all. So Dr. Kordzo will be talking to us about what it's about, what the screening entails, and just basically just encouraging us or giving us more knowledge about it so that we're more confident in going to our screenings. So please, ladies and gentlemen, without further ado, welcome Dr. Kordzo, who is at your cervix today. Welcome, Dr. Kordzo.
Thank you. Good evening, everyone. It's good to be back. Thank you, Abna. Thank you, Lady Baba. Nice to get on board with everyone. Today we're talking about cervical screening awareness. Trying to see if I can share something here. I don't know. I'm not able to share it. What happened? Please give me a minute. Let me see. I'm not able to share, so I might just do it like that. I've been nice though to you.
Well, but maybe can you share with the technical team? Maybe they'll be able to help. Or
Okay, let me see. I'll just share it to them. Give me a minute. Give me a minute. Give me a minute.
Lady Abner.
yes, Lady Baba.
While Dr. Kojo is sorting his screen and everything out, I just wanted to ask, how is the weather at your end? Is it cold?
Terrible, terrible. Typical UK weather. I think I've experienced like summer and spring, a little bit of winter, I would say, but obviously it's not as cold, but all in a day. How about you?
It's been raining actually. At some point for a few hours the sun was out. I thought, okay, yes, it's going to get warm, but then no, it's very windy and cold all at the same time. So yeah,
Yeah.
not good. Not good.
Well, apparently next week it gets really warm, so we're back to summer next week. Oh, and
Yay.
Dr. Kojo is on. So
All right, can you see my screen, everyone?
Yes.
All right, great. Let me see. All right. Let me try and do it full screen. Is it full screen now?
Yeah, I would say yes. Do you want to move to the next slide just to?
Yeah. All right, cool. Is it okay?
Yeah, we're good.
All right. Sorry for that. So as I said earlier, we're talking about cervical screening, and we cannot talk about cervical screening without getting to know what the cervix is. So what you see on my screen or what you see on your screen is the cervix anatomy. It has other vital, what's it called? Part that you need to know. But if you can see my cursor, my mouse cursor, you can see that this is the cervix. So the cervix basically is the doorway between the womb and that's the uterus and the vagina. You have the house. Before you enter the house, there's a door. You can't just enter the house like that. So there's a door. So the cervix is the door. So what you see here is how the cervix looks like. I know that a lot of people talk about cervix, but they don't know how it looks like. So today, finally, this is how the cervix looks like. Very, very, very small. It's just a pathway, and that is it. That's what you need to know about that. Okay, next slide. What causes cervical cancer? HPV. I'm sure that a lot of people have probably heard about HPV. If you have never heard about HPV, this animated virus here is HPV. It's kind of looking beautiful and ugly at the same time. Just because I had to pick that particular one is because sex is meant to be enjoyable, and then human papilloma virus is actually a common sexually transmitted infection. So all you need to know is that it is sexually transmitted. It can affect the skin, the genital area, and then the throat. And I've always been an advocate on this platform that before you have sex with anyone, you should make sure that you've run the necessary checks. If you are into something like oral sex, which I am very much big on, I'm like, don't just go ahead and do whatever you want to do or go down. It's not something that you should do if you don't know the person. Or even if you know the person very well, there are precautions that you should actually take. So if you can see this, it can actually affect the truth. So whatever that you are doing, you need to be very, very careful. Make sure you clean, make sure you run the checks and all of that. But anyway, condoms, that each and every person feels that it is the safest way. We know that condoms can break, but at the end of the day, condoms help prevent HPV, but it does not offer total protection because they do not cover all the genital skin. So if you have a cut, I always tell people that before you have a sexual intercourse, people believe in shave before you go, keep the place clean and nice. But if you shave a day before and then you go, you might probably cut yourself. And what are you doing? You're exposing your skin to some of these things. So it is advisable for you to shave. Make sure you've disinfected the place, and then wait for a while for if there are any cuts or whatever that it is to heal properly before you engage yourself in sexual activities. If not, if you have an open skin or a cut of that sort, you can actually get an infection through that. This HPV, human papillomavirus, it is known to go away on its own without treatment. But there are different types of HPVs, and some of the infection can cause what we call genital warts. I don't have a picture. I should have probably brought a picture, but I don't have that. But anyway, you can Google it and look at how genital warts. And also, some of them cause abnormal cells to develop, which grows to become a cancer. So that is what we are actually looking at. That's what causes the cervical cancer. So according to research, the highest prevalence of cervical HPV among women is in sub-Saharan Africa, about 24%, followed by the Latin America and the Caribbean, 16%. Eastern Europe has about 14%, and Southeast Asia has about 14%. So this according to WHO, and prevalence in men is highly variable based on sexual trends. Also, evidence shows that the prevalence of the virus is normally higher among women living with HIV, men who have sex with men, and immunocompromised individual. When I say immunocompromised individual, in layman terms, those who don't have what's it called, strong immune system. So yeah, people with co-infection with other sexually transmitted infections, and also people who take immunosuppressive medications, and children who have also been through sexual abuse. So there's a research according to the WHO. If you go there, you have more information over there for you to actually. So this is actually good to know. I think you should probably pay attention to the evidence part, where it is higher in women living with HIV, men who have sex with men, immunocompromised individuals, people with co-infection with other sexually transmitted infection. Those are the places that you should probably look at. I would probably say the risk factors. So yeah. Symptoms of cervical cancer. Normally, it is asymptomatic. The immune system usually clears, as I've already mentioned, from the body within like a year or two with no lasting effect. But then some HPV infections cause more. That's how the genital works. So they are describing the genital wart, which is a rough lump. I don't know how to describe it. But anyway, it's kind of a rough lump that actually appear at the vagina, penis, or your anal area, and really the truth. But there are some things that your truth can also pick up, but it doesn't actually form your truth. That's the wart itself. They may be painful, itchy, they can bleed, they can bleed, probably due to intercourse, when you wear tight stuff, anything rubbing against it, it can actually bleed on its own. So that one too is something that you should probably look out for. The human papilloma virus, the one that actually causes this cervical cancer itself. You realize that because you don't see it, it takes a long period of time for you to actually get to know. So it is always advisable for us to go screen. That's why we're talking about the screening, because some of these little thing causes, it leads to pre-cancers, and later become the cancer cells if it is left untreated or if there's no intervention. So it can take about 15 to 20 years for cervical cancer to develop after the infection. So you've probably had a sexual intercourse with someone today. It will never show. It will take you like 15 to 20 years before it can actually show up. So what do you need to do? That's why it is advisable for you to go in for that screening. I'll come to the screening so we talk about it. There are changes that goes on in the cervical cells, and they're precancers. Like I mentioned, they do not cause any symptoms. So if you notice bleeding between periods or after sexual intercourse or any foul smelling, but then again, these symptoms can be due to any other disease or any other infection. So you wouldn't really know what exactly it is until you go in and run the screen. So what is cervical screening? It's just a test mainly to prevent cancer. And what are we looking for? It looks for high-risk HPV, like I've mentioned. The cells changes that could become cancer later. So it's like a car bonnet. You hear a noise in your bonnet, you go open it trying to look for where the noise is coming from and then do something about it. Basically, that is what the cervical screening is. The name of that is called, the name of the test that we normally do is the pap smear. And it's just, I'm sure that a lot of people have heard about pap smear. Sometimes people get scared when they hear about pap smear or anything that has to do with, let's say, any test that has to do with you going inside the vagina. But I'm going to explain how it is done so you understand, so you realize that it's not a harmful test or it's not painful like that. So yeah, this is the test that we do to detect the abnormal cells before they become cancerous. So your gynae or your what's it called, gynae nurses in the department, maybe your GP. I'm not sure whether your GP do this, but I want to believe that if it's a gynae case, you go to the gynae. They are the ones going to do this. So like I said, we are looking for abnormal cells. So an unclear or abnormal pap smear result may be a sign of infection, another problem, or cancer. So basically, we go in to see what is happening in there. What happens during the test? So the cervix, like I showed you earlier on, this is how the cervix looks like. So when you come to the hospital, when you come and then you meet me, I'm a very nice person. I'll welcome you very well. I'll get into chit chat with you. What brings you here? Or you have probably been booked. What am I going to do? I ask my assistant or my nurse, and I'm going to call her Jamie. So Jamie is going to come and I'll explain the process to you. Jamie will probably also talk to you, try to make you feel at ease, calm you down. Then we get you a bed. You lie on it. If you're wearing anything tight, or basically anything down should come down. We cover you nicely. I won't be there. Jamie will be the one to do all these things. Then you lie down. You open you open your legs because we need to go inside. Then what do? We have what we call the speculum. This is it. First of all, we need to keep the disinfect the place. So we have everything that we need to do that. So we clean there very nicely. We bring out the speculum. This is it. It's just a plastic that we use. Back in those days, they used to use metals and all, but these times you go in and it's plastic. We use it and then we dump it. We don't reuse it. So that's what we do. We go inside, we screw it just to open it, so we get to see the cervix itself. So we get to, your vagina comes before the cervix, so we have to open it. We open it like this. It's like a parrot, when they're a parrot or a bird. So this is how it is. So we screw it and it opens like this. So we go inside and then we see how the cervix looks like. Then we get our brush. We just use a brush. So what do? We just go in, just like, the earbud. When you go inside that thing, exactly. That's a perfect example. So we go in, we just take a sample over there. We scrape it, and then that is it. We are done. You're ready to go home. The rest is for the lab. We take that sample, we put it on a petri dish, we cover it, We cover it very nicely. We send it to the lab. They do their microscopic test, and then they get to find out what is in there. If there are any abnormal cells, whatever that is, they will come with the interpretation that we would actually take it from there. Simple as that. So don't be scared of going to do a screening, or if we say a pap smear test or what, go run a test or anything of that sort. Don't be scared. It's not a scary process. It's very, very simple. I've explained it so that if you have a younger sister, you have never had it before, or yeah, just go. Very simple. It's not painful at all. So yeah, that's what you do. How do we prevent this vaccination? So you can see HPV is coming head to head with the vaccination, but as you can see, the vaccination has this pin. It's going to pop. HPV is going to fall down flat because the vaccine is fully active. Let me see. I think I'll talk about the vaccination a little bit. So basically, it should be given to. So I think every country also have the way they go about their things, but according to WHO, what we do is that it should be given to girls, all girls aged 9 to 14 before they become sexually active. The vaccine can be given as 1 or 2 doses. Depends on the situation you find yourself inside. People with HIV, I think, get, if I remember very well, 2 or 3 doses. And you need to check all these things with don't go in and say, I said this and that, but then whoever is attending to you, your healthcare professional is going to attend to you and then propose what they have to do based on your situation. So basically, that is it. I think there's this. So women should be screened from 5 to 10 years, starting from the age of 30. Mind you, every country also have the way they go about. America has a different system. The UK, Ghana, some are similar, but then women should be screened every 5 to 10 years, starting at the age of 30. And also, women living with HIV should be screened every 3 years, starting at the age of 25. I think some of these things will come from the question, so I'll just leave it so that if anyone has a question, and I know that there are some healthcare professionals here, they might probably chip in on 1 or 2 and then all that. So yeah, treatment. There's no current treatment for HPV infection. Treatment exists for the genital wart and cervical precancers, and then, mind you, I said there are different types of HPV. So what we normally do is when it comes to the genital wart and these pre-cancers and then cervical cancer, the most important thing or the most effective thing that we do is that we need to give you this vaccine to be able to combat these things so you don't end up getting some of these things, right? So the non-cancerous ones, like I mentioned, the genital wart, the lesions in the cervix, vagina, vulva, anus, or your reproductive area, they are removed or treated by what we call ablation, either by freezing or heating, or we do surgery. Cancer of the cervix, that's the cervical cancer, is the only HPV caused cancer for which screening tests are available. And treatment for cancers caused by HPV, including the cervical cancer, are more effective if it is diagnosed early. So just like I said, it is very important for you to get screened and also get the vaccine. And we always say that treatment should begin quickly after diagnosis. So that is for treatment. I'll end it here. No one should die from preventable cancer, and cervical cancer is one of the most preventable cancer that we can find. So thank you very much. I'll take my questions now.
Thank you very much, Dr. Kordzo. Q&A is to follow shortly. We'll go for a quick commercial break. And before we go, I believe we have a special guest today by the name of Dr. Elijah. So a special welcome to you. So yeah, we'll go for a quick commercial break, and then Dr. Kordzo is dying to take your questions, and then we'll come back and we'll have the Q&A session led by Lady Baba. So don't go anywhere. Be back shortly.
Sikamania. Pretty me do rap just. From me send in a minute in Sabacandia and then one tap send.
Yeah, ebusiafo bidin di na nakoma pachirewa 1. They recommended Taptap Send amamo. And that's how for aba. O send ko fa baby a. Na ye basa. Omo rating so ye. Omo ye A1. Nti obia load do Taptap Send. Na on say sika for Taptap.
Yɛbɔ hu de wɔkyerɛ amansan yɛbɔ hu de wɔkyerɛ Ghana fɔsɛ yɛwɔ akwantu mu yɛde sika kɔfie nie meyɛ mfɛmfa baabi a yɛbɛnu yɛn ho tap ɛdɛmu tuwa tap send in this street
Tap de no ana ɛkɔ.
Tap and one na
Piao.
Hello, this is Lawyer Wisdom of Wise Smart Solicitors. Join me this and every Friday on OT TV from 8 to 9 p.m. for all your UK immigration matters. I hope to see you there. Thank you.
Hello and welcome back to the Q&A session. So I will hand over to Lady Baba now to lead on this session.
Thank you very much, Lady Abna. So I've got a few questions here, Dr. Kordzo. So the first question is, when should I have my next cervical screening test? Especially if someone is at the age of 18 and they are sexually active, when can they have their screening test done?
At the age of 18.
Yes.
Okay. Has she ever had like one before?
That didn't come up.
Anyway, so at the age of 18, I want to believe the person is in the UK. I think it is not, unless I stand to be corrected. Like I said, every country has theirs, different age groups and all that, but I think it's not offered at 18 because the NHS actually invite people at the age of from age 25. I'm not too sure. I stand to be corrected. So 18, I don't think so in the UK, but from 25, I believe so. Unless someone who actually works with the NHS know better than I'm saying, yeah. Or 21, I believe so, yeah.
Dr. Akushi in the if I'm saying in the what's it called in the audience, but yeah, any healthcare person who
I've just said in the chat, you're right.
Okay, cool.
Okay.
Right.
Thank you very much. And the next question is, if HPV is found, what are the next steps to take?
If you were following my presentation, I said that the moment we start to find, first of all, the vaccine is the ultimate, but then if it's not that effective after it has actually been found, I want to believe that it is what causes the HPV cancer, but then it's not that as effective as it could be. But regardless, where I'm coming from, they do give it anyway. And you have to, there's a plan that they follow, your healthcare professional follows that with you, that they believe can work for you, or a structured program. Sorry, can we see your face? Oh, is my video on?
No.
Sorry.
Yeah, her ceiling sign.
Sorry. Am I okay? I'm back. Yeah, cool. All right. So, when they find the HPV, first of all, the HPV doesn't mean that you have the cancer. So we still need to do the pap smear test to confirm that that is what you actually have. Because, like I said, we have different types. So, and then we have to check whether these cells are going to cause, they are the ones that we actually, the deadly ones, the one that I posted, the picture, the animated one, the smiley and then the ugly one. We have to find out. So, one, if HPV is found, if they detect that it's a high risk, they have to detect that it's a high risk of HPV in the cervical sample. So these are the steps that I'm giving the person. The same sample is also checked for abnormal cells. So that is what we are actually looking for. And there are two possibilities. So one, HPV is found but no abnormal cells, and HPV is found and the abnormal cells. Then we know that okay, fine, you are hitting the what's it called, the pre-cancer or cancer state, depending on the time that you actually go to the hospital. So those are the steps that we are actually going to take when you have HPV, or if we detect, we do further tests.
Okay, thank you very much. The next question is, does my medical history affect how often I should be screened?
As in, I'll need more clarification.
So their medical history, does it affect how often they should be screened for the HPV or?
I'm still trying to understand the question, unless maybe I don't know how the medical history, like what exactly is the person talking about. If the person can probably come back, like clarify, because I mean, if you have a medical history, how is it going to affect? I really don't know.
I think, from my understanding, maybe they're trying to say something like, does having sexually transmitted infection in the history, or does having something like diabetes or blood pressure, does their medical record or having existing problems affect how many times they should be? I think that's the question. That's my understanding of it anyway.
If that's your understanding, what is your answer to that, Dr. Cruz?
You are trying me now, Dr. Chris. Okay. So, okay, can you just repeat the question?
Okay, so does my medical history affect how often I should be screened?
How often? Okay, fine. No, it doesn't. So from the screening process, I think it starts from 25. And correct me if I'm wrong, I think it used to be every 3 years, but it's now every 5 years, isn't it?
Yeah.
Yeah, so okay, fine. So I get that mixed up.
Those with HIV is 3 years.
Yeah, so that's the answer to the question right there. So those with HIV is 3 years. So some aspects of your medical history can affect how often you're called back. And if you've had a positive result in the past, then it's you're called back after 1 year. After you've done your colposcopy, you're called up after. So yes, your medical history does affect, but it depends on what medical history. So unless the person is asking for a particular medical history, or they're just asking in general, things like diabetes, blood pressure, and like your common stuff does not affect how often you're called back. But there are some other things that do affect it. So yeah, they can ask a specific question if they want.
Can I ask a
I think
question?
the last one that I'll add to that, sorry, the last one, if you are on any immunocompromised, immunosuppressants, it's likely that you'll probably be called back, or there should be an adjustment or something like that. So that's the only thing I can add to it, based on the medical history that the person has.
Okay. So you understand the question now?
I understand it.
Yeah. Thank you. Lady Abuna.
I was just going to ask, by the way, a question, by the way, probably more for Dr. Akos. Why has it been moved from 3 years to 5 years?
Money. Lots of money. Everything in the NHS has to do with money and how affordable it is. We realized that, and I guess studies have also shown that the 3 year and the 5 years does not make much of a difference. Whereas obviously, if you think about it, if you're screening people every 3 years, it's a lot more expensive on the NHS. So I guess that's why they've moved it to 5 years. It won't make much of a difference in terms of how many people we do diagnose with the disease, but then it's going to be a lot more cost effective. Again, this is my understanding of it. It's not fact, so I don't know. You can do a little bit more research on it, but that's how I understood it.
I mean, I'm just curious because if say on my, I get 5 years is a bit okay, fine.
Yeah, it's a
you can
stretch, isn't it?
you can test negative and get a positive within that 5 years and not know from what we're saying. And if you're lucky, then your body might clear it, but if you're not, it just continues to deteriorate until you're negative.
But the curability at that point, so for example, if you test within your 3 years you're fine and then you get it. We know that within those 5 years it's not detrimental, if that makes sense. Like the progress of the condition is not going to be to a point where it's it's incurable, or like it will affect you to a point. And that's why, because let's think about it even this way: you could literally have even with the 3 years, you could have your smear, like let's say this month, and then by the end of the year you could get HPV, but you're not due another smear until what, 3 years time anyway. That's another 3 years, so we know within that time it shouldn't be too much, especially if you're asymptomatic. If you start to develop symptoms, obviously you would see your GP, so it'll get found out anyway. So that's why that 5 years it doesn't really make a difference medically, from a medical research point of view.
Okay.
Can I just contribute a little bit about that as well? Hi, everybody. So the little research also showed that with the vaccination program, we're getting to the ages where people that are having the smears were lucky enough to have the Gardasil 9 vaccine. So NHS is looking at it that if these people have had the vaccine, there's more protection. So you don't need to screen them as more frequently as you would do with our mothers who never had any vaccination, especially Gardasil 9, which protects every, head, neck, and throat, the HPV virus. So that's one of the reasons why it was moved to 5 years, because we're getting to the population where people have had the vaccine. So the probability of getting a positive smear is less. Does that make sense?
Mm-hmm. Mm-hmm. Yeah. Thank you for adding that.
Yeah. So the research has shown that the vaccine is working. So we don't need to do that much of screening any longer. And 5 years is not too long a time, especially if you've had Gardasil 9 vaccine, which protects against the 9 bad strains of the HPV.
Thank you for that. Now those are facts.
So for those of us who haven't got the vaccine, can we restore it? For those of us who don't have the vaccine, can we restore it back to 3?
Then it goes back to money.
Exactly, money. But I think again, correct me, but when I was in Scotland, I remember that, so this was a thing, because when I was in Scotland, obviously screening started at 21. So I remember that I got screened before you did, Abdullah, because I think you were in England at that time. And I remember saying that, because in Scotland it starts at 20. I don't know if Scotland have kept it at 21 or if they've moved it to 25. But again, these are some of the subtle differences in healthcare, depending on where you are in the UK as well. So it's best to also check with where you are. So because I know Scotland healthcare is much better and quite different to England. So
much better.
Thank you so much for your contributions and your questions. Dr. Kordzo, you did mention that before you get sexually active with anyone, you should get tested prior to that. So what happens if you don't get tested? Because nowadays people are even married, and of course they don't get tested because that's your partner, isn't it? So what happens? What do you do?
Lau. I always say that it's better to know than to pay for it for the rest of your life. It's not too late if you are married. Even if you are married, you're in a relationship, and you are sexually active, it's never too late. If you are still with someone, encourage the person. Both of you should go to the hospital and run all the necessary tests. To me, I think it is much more important, and I always say this, it is much more important than any other thing. The dress that you want to wear on your wedding day, everything, because if you don't know the status of an infection or anything of that sort, will that dress matter? At the end of the day, it won't. So please and please again, and I'll keep on saying this, the moment you find a guy coming to toast you, right now the ladies are also asking guys out. I mean, if you ask them out, you won't die. So please whatever the case is, whether he or she, please go get tested is very, very important, because if you come to me, I won't really be nice about it, especially if you've heard me talk about it. So, yeah.
Can I just ask or add to that point? Because you say that you should get the necessary FNSA test, but from what I know, especially when you normally ask for a STI standard FNSA test, that they normally just check for HIV. I think it's syphilis, gonorrhea. I think it's like 3 or 4 pet. So if you are unaware of HPV being a sexually transmitted disease or any other thing that is, what tests would you say as a doctor people should be running? Is there a list that we can have?
What, let me see if you missed something out. What test did you mention? You said,
I think the standard one that they do, I think it's the syphilis, gonorrhea, there's another one, chlamydia, and then HIV. I think these are the 4 standard if you were to go into your sexual health clinic and you want to do a test.
I don't even think we do syphilis. Isn't it like hep? I think we do hep. I don't think we do syphilis routinely.
Hep, no, I don't think hep. I don't think it's hep.
Okay, fair enough. I can't remember, but yeah.
I think these are the 4 that if you walk into your clinic today, they're going to do it for you. But you know, hep is even another one, because you don't normally think of these things like on the spot like that.
great. That is the reason why, if anything, you should find Dr. Kordzo Asamany. If you come, I'll sit you down and I'll talk to you about all these things, what you need to know and what is important. To be honest, you might, like you say, we may never run certain tests, like you may probably never know. But thanks to, should I say, education now, or sexual education that goes on, because before you actually walk into a hospital and then you go, like, maybe you want to start a relationship, or you're in a relationship, or you are getting married, what are the necessary steps that you should do? Thanks to technology and the phone that we have, first of all, do your research before you go in. What are the necessary tests? So when they give you all these things, when you go ask your questions, ask your GP all these questions, or whoever is doing it for you. If it's your gynae, just go in and ask all these things. Some of the HPV itself, thankfully, when you are, I don't know if they run it here, but listening to Dr. Coase when she said she had a screening in Scotland at the age of 21, I want to believe that at a certain point they call you in for it. So far as they have your medical report, your medical records, they probably call you in for it. So some of these things are probably dealt with from the beginning or when you are younger. But when we go back home in Africa, some of these things are not in place like that. But as a child, whilst you're going to the hospital at a certain age, it is being called on when you are probably your mother takes you to the hospital at a certain age, or you're not even feeling well, or at the point where you are probably getting sexually active, even way before that. When you go to the hospital, it is known, it is something that the doctors will probably let you know. They will speak about it. So it's not as if you probably just, unless you don't go to the hospital at all. But so far as you enter the hospital one way or the other, it gets to a certain age where, or it gets to a certain time where the doctors, the nurses, they bring your mind to it and something that you do. So when it comes to those ones, right now it is way better than what used to happen before. But other than that, I just want to believe that it is by the grace of God that people are moving and then they don't have some, or they don't know about some of these things. But the standard ones that you mentioned, that's what they are going to do for you, like everywhere. But I believe that when you are way younger, some of these things will be looked at and then the necessary things will be done. But unfortunately, right now that you are hearing of it, if let's say you've never heard of it, right now that you're hearing of it, what can you do? You can actually go back and then do what? Go get yourself checked or tested. It's yeah.
I think if I just come in here, Dr. Kordzo, because I think the NHS does not actually offer HPV. Don't screw me. I don't make the rules. They don't offer the HPV testing, even if you request it. Because I was trying to, when you said that, I was trying to think, I don't think you can actually request a HPV testing here. unless you maybe go privately. And I think the reason is because, again, they say that most people who do get HPV, it clears naturally. And unless you're getting symptoms or there's a particular reason why you feel like you should test it, like maybe you've had intercourse with somebody who has then been tested positive for HPV, unless you have a reason, I don't think you could walk into like a gum clinic in the NHS and they'll do it for you for free. So that's one. And Abna, you're right about that. So it's syphilis, gonorrhea, chlamydia, and HIV. Those are the main ones. So even HEP is not one. So again, unless you have a reason, as we know with the NHS, unless you have a reason for thinking you might have been exposed to HEP or HPV or all those other ones, they don't tend to do it routinely in gum clinics.
Thanks for bringing my mind to HPV test and then pap smear. What you need to know is that the HPV test, like I said, we have different types of HPV. So the HPV test check for certain types of HPV, depending on what we're actually looking for, that actually increases your cervical cancer risk. And the pap smear actually looks out for the precancerous and cancerous cells. So depending on what we are actually looking at or depending on what we are going in for, that is what they will probably, and this is not even for you per se that, okay, you want to go and do, maybe when you go, I don't know, like you said, maybe this place they might not probably do it, but in Ghana you might probably find your way to just go and then ask. But even with that, why do you want to do it? Like certain questions and all that. If you say out of curiosity, I don't know whether they will do it for you, but it depends. So yeah.
Thank you very much, Dr. Kordzo and Akosua. Before I go on to ask a question from Susan, just like you mentioned, should that be a reason why you need to have the test done? So say I walk to any hospital and say I want to get the test done, do they really need to ask you why? Because you've done your research and you think, okay, you are at a stage where you want to get tested, especially coming from Africa, somewhere in Africa, and you don't get that privilege of having, like, being sent a letter to come and get some tests done. Does anyone have to ask you why you want to get the test done? Like,
okay. Dr. Kozi might probably help me with here. But back home, if you come to me, if you walk into, if I'm in the consulting room and then you sit down, the first thing I'm going to ask you, what brings you here?
Yeah.
If you ask me, you're coming for HPV or pap smear test, I'll ask you why. Because I want to know what brings you there, why you want to do it. Because, I mean, it's more like investigations, right? You really want to know why it is like that. Is it necessary for, because you never know, maybe the person has done it out of argument, something, peer pressure or something of that sort. They still just want to do it for doing its sake or something of that sort. So you really want to know the reason behind it. Nevertheless, we shouldn't deny people who want to, probably they've never had it. You can't just deny them, but it gives you an opportunity to educate them on it because they might have questions. So it's good for you to ask a question for a follow-up question to come up. Because where you probably read something on the internet, and what is the internet saying? Okay, fine. In a natural sense or medically, this is what we do, this is what we don't do, and this is how it is. So I also want to know, because it's an investigation process, to help you, the patient, and then myself arrive at an understanding. So we can work together, yeah.
Okay. All right. Thank you very much. So a question from Susan. Does it mean every woman needs the vaccine then?
What do you think, Susan? Do you think you need it?
No, I don't think I need it. But from when you were talking about all women, the vaccine being effective and after years and years, and that's why probably they have increased the number of years before a test. So I was just asking, like, because I haven't known them offering vaccines for free. I didn't know much about it anyway. So I was just asking out of curiosity, is it like every woman, apart from the test that's done every 3 years, now moved to 5 years, is it like every woman needs a vaccine then?
Okay. So
that was when you were talking about the vaccines.
I get you. I understand. I get where it's coming from. Anyway, so I would say, so far, in as much as it's highly recommended, not all women need HPV vaccine. Why do I say that? It is less beneficial for older women. So why would you even less beneficial for older women who have been exposed to the virus? What is it really going to do? It might not. So you probably don't need it per se. So yeah, not every woman or anything. Yeah, that's what I can take it to that.
I also
And also, I think during pregnancy, I think when you're, I think so when you're pregnant, I think you have to, normally we delay the vaccination after the baby is born. And yeah, and also it's safer during your breastfeeding period. Yeah, I think that's the only time we also delay that. Yeah.
In the UK, though, the vaccine is for both boys and girls now. It's not only for girls.
Hey, that one, I don't know.
Yeah, it is. So,
yeah, it is.
Yeah, it is. So you boys, because it's for head, neck, and genital cancers.
Yeah.
And obviously everybody has got a head, everybody has got a neck, and everybody's got a genital. So in the UK,
well, I mean, boys get the genital warts too. To be honest,
they do. Yeah. So in the UK, it's offered from year 9. So boys and girls are offered it from.
And also because boys tend to spread it. Yeah, and because boys tend to be the ones also who spread it a lot. So
yeah.
And then obviously girls suffer are more susceptible to genital disease, whereas boys are not. But boys are more likely to carry it. So again, if they get the vaccine, so that they're not carrying it around, so that reduces it to girls as well. Yeah.
They try and get you before they are sexually active.
Exactly.
So yeah. So that's why they get it from year 9, which is what, 12?
Yeah.
12. Yeah, 12, 13. So, and it used to be 2 vaccines and now it's just 1.
But they're not too young to be getting vaccines at that age.
No, I think they get it. I think they do.
Yeah, no. You start vaccination when the baby is 8 weeks. So 8, 12, 16, you get your primary vaccinations as a baby. Then you get your 1-year MMR, and obviously when the bit about Hep B came in, if you are a Hep B carrier, then your baby gets the Hep B vaccines as part of their childhood immunizations. And then when they're 1 year, they then test the baby to see if they're also going to be a carrier. So it's a robust vaccination schedule in the UK, and screening and testing. You just need to speak to your immunization team if you've got a young, you're thinking about your children, about the services that are available from your school, from your child's school, from the GP, from your health visitor, right through. But vaccination starts early, definitely.
Okay. I think what I do remember is that according to the Ghana public health policy, it is strictly for girls. I think age 9 to 14. We don't do boys. It's not under the Ghana National Public Health Program unless they've updated it. But as far as I remember, about stand to be correct, if they've started doing that, so that's why I don't know. If I was in this,
you've got something to be doing then.
Thank you.
Help the Ghanaian authorities realize that the boys should be vaccinated. But I actually wanted to ask a question because I think you mentioned something about if you're older, or you've already had the HPV.
The vaccine is less beneficial.
It's less beneficial. So I think you mentioned, and from what I know, the little that I know about this HPV, there are various variations of this. So if you've been susceptible to one aspect, I don't know, whichever aspect, like if you've been susceptible to one, I assume, say you've been susceptible to, say, one type of variation, is it still not beneficial to get a vaccination against the rest? And when you say older women, how old are we talking?
So your first question, other type of HPV. To be honest, when I started saying, I said that the body actually clears this by itself. You get me? So sometimes it's not needed unless they find out something that needs to. I really don't know the potency of the vaccine if you've had the other, what's it called, the other viruses and what it can actually do. But what are vaccines? Vaccines are used to prevent it, not to treat it. You get my point? So I don't think it will still be beneficial. I don't think so unless.
And if I can just also add in that in the new screening that they're doing, the reason why another reason they've moved it 5 years. I've just had a quick read. Is because so apparently the efficacy of the current screening program is very good and very effective, that it can catch any cancerous cells years before. So up to about 5 years before anything develops, so even before you've got symptoms. And that's why, so even before you've had any symptoms, the screening that they're doing can catch the changes in the cells about 3 to 5 years ahead. So that's why they've changed. So in a way, if you're keeping up with your screening, again, you don't actually need the vaccine, because if there's anything that's going on, so far as just keeping up with your screenings, you shouldn't be getting anything, or nothing should be sidelining you. In terms of how effective the vaccine is made, I think, against 9 variations of the HPV. So it is quite good to cover a broad range. But like I said, if it's on the NHS, they're not going to do it. If it's private, you can. And back to the question that somebody asked, why would you ask me why you're here? Well, you're not spending your own money, you're spending my money, so I need to know why you're here, if that's the NHS. If you go to a private doctor and they ask you, why do you think you need the vaccine? And you say to them, doctor, I just think I need it. They can give it to you because it's your money you're spending it. I mean, we ask because, like Dr. Kojo said, it's good for us to know. We're able to document it. We're able to advise you to say, actually, if you've been to Thailand and you've met this person, we think you should be testing for HIV instead of HPV. Like, it's more of like coming from an investigative and an advisory way that doctors tend to ask you, and sometimes because we want to gossip as well with our colleagues. But if it's private and you literally say, no, I don't want to tell you, I just need the vaccine, you'll be able to get it. But if it's on the NHS, you won't, because it's not your money you're spending my money. So I need to ask you why you need it.
Dr. Kosuba, why Thailand though?
Pardon?
Why Thailand?
Because it's always Thailand in the exam questions.
Thank you.
To add to what I think the 9 variations, it's good to know. You really don't have to know, but I remember in school, I hope I don't make a mistake. There was a mnemonic, this 9 variation, the types that you need to, that is, we actually pay attention, or that the vaccine covers. It's 16, 18, 31, 33, 45, 50, 52, and then 58. And there's this mnemonic that we used to use back in school. We say that at 16 and 18, you are a teenager. In your 31st and 33 or 33rd year, you buy a house. 45, you change careers. And 52, 58, you plan for retirement. And that is something we used to. It's good to know. You don't have to know it, but I'm just showing off. Thank you.
That was a good one. We have to learn it. Lady Abna, would you?
I was just going to ask something to the doctors, particularly the healthcare people here in the UK, looking at Dr. Kojo. So you know how important this is, and some people do not, even in Ghana as well, Dr. Kojo. I don't know how the system in Ghana works, but why is it not mandated? I mean, can you not? Is it maybe force is a strong
Free will.
But like, if someone is, I don't know how to say it, but like, it's so important. So if you get invited, if you don't come, you don't come. That's not a problem.
You know what? Gosh, I shouldn't do this, but I should, just so people know that doctors are human beings as well. So I'm overdue my smear for like 10 years, right? Like I'm literally overdue. It's funny because the time that I was again, like I was saying, obviously I was in Scotland last time I had my smear. When I moved to England, I changed GP, so that took about a year before they noticed that and then they sent me a letter to say, oh, you need to get it done. The smear is not a very comfortable thing, right? Even for me as a healthcare so I kept like putting it off. Oh, I'll do it later. I'll do it later. And then I got pregnant. And obviously, when you get pregnant, we don't do the smear whilst you're pregnant. So I just recently had a health check with the doctor, and the doctor was like, "Oh, you're overdue your smear. Make sure you get it booked." And in my head, I'm like, "Yeah, I need to get it booked." And you're not allowed to do it after 6 months after you've been pregnant as well. So like obviously 6 months. And in my head, I'm like, yeah, I need to get it booked. But this is how people slip under, and this is even coming from me, a healthcare professional. I'm like, shame, of course, bad. Beat. But this is how people, and you can even tell that's coming from me as a doctor who is literally ignoring these smear things. Now, think about somebody who probably doesn't understand very well why they need the HPV, okay? They think this is very uncomfortable. I'm going and somebody's shoving a brush up me and literally scraping. Sometimes some people actually even bleed from it because some healthcare professionals are very careless with the way that they do it as well. And, they don't think so. If you've had a bad experience of it before and you don't actually have a proper reason why you need to do it, you might easily say, I'm not going to bother with it. And as you know, this is a country that we allow free will, freedom of speech, everything. Nobody's going to force you to do it. You're an adult. So that's just an example coming from me. But don't be like me. Don't do what I do what I say. Thank you.
Thank you, Dr. Kojo. Is it similar in Ghana as well, Dr. Kojo? So it's just if you like yourself, come and do it. If you don't,
to be honest, one thing that my boss does is, in Ghana, the system is quite different. When you come and then I'll just use my boss as an example because he's just one out of many. You come, you are of age, or you come with your parents, your mother, or something of that. So he will catch you and do it for you by force. Like he will do it for you. Sometimes we need to know. Sometimes we are always complaining about data. We want data so that we'll be able to do this. You are probably going to the Ghana Health Service and you are writing to them, we need vaccines, we need this, and they are also asking you questions and all of that. So my boss, in his own way, just because where the hospital was in a small community, what he actually does is that when you come, he will do it for you for at least whether you know about it or you don't know about it. And it was a rural area, so some people don't even really know about it. But guess what? They will probably grow up one day and then they'll be grateful. Maybe they might not know that my boss was helping them at that time. So in Ghana, to be honest, nobody really forces you. Some people will never even mention it because there are a lot of people coming in. We don't have time to talk about those things. So you come and then complain. They'll complain that you have is what we actually, and we are, some people are in a rush to see the next patient or to kick you out to go home or something like that. So because, mind you, doctor to patient ratio, it's a problem. So we really don't have time for that.
Thank you very much, Dr. Kojo. One thing I'll add to Dr. Akwasia's comments is, yes, the test is uncomfortable, but it depends on who does it. And it's not so bad. It's really quick. And the brush they're talking about, it's not something big. It's just like Dr. Kojo said, it's like an ear swab kind of thing. And it's basically like they're tickling you. So if you haven't had yours done, kindly get yours checked or go and get it booked one way or the other. It's better to be safe than sorry. Lady Abla.
Sorry, before you call Auntie Liz, or I don't know, before you say what you need to say, to be honest, if like you are like, let's say that age 9 to 14 or something of that sort, I mean, yeah, but you feel comfortable, you are innocent about it, and then that's why if you come and meet someone like me, I'll try as much as possible to calm you down. And I'm very good with that, so that one is no problem. But if you are older, please, some of the things that you during sexual intercourse, that is way bigger than that thing. So please, it is not the uncomfortability. I learned this thing from my boss. We say it as it is. We don't like to go cut corners and all of that. Some of your partners or whatever that it is, that one is even much more uncomfortable. So don't let this that is going to save your life deter you from going for the test. Please.
But that's not plastic.
It's of course, but it's not plastic, but is something, and it's much more painful than the plastic.
As Dr. Ko said, some people bleed from it. So I think with everything, you have to apply gentleness, gentility.
Thank you.
Exactly, gentle. The same way
So, like,
people
it's
are
not about the person
gentle.
being old, it's about trying to get the person to come and do it in the first place.
But I'm just
You have
trying
to apply psycho to the situation.
That one is there, but some people have already been in the game. So if a plastic is coming, face the battle as it is. Thank you very much.
No problem. Auntie Liz, please.
Yes.
The question, no cramo ya mami refi. Hey, young people, more how you Okay, the question, Dr. Kojo, this was Wokasan and Nonibaye. Is it free in Ghana?
Oh, yes.
Oh, okay. That wasn't the question though, but it's good to know. Now my question is, just Dr. Abner, and then the comment that me throw you one read ya mam so then can pesa wa na wo kan.
Oh, sorry.
Okay, there one need the woman there responding to that part is done, but what dear no. Ubo Dr. Kojo din anetches anyway. That's not the question either. Now the question is from 5 years to 10 years, what age does it change from, like you go every 5 years and then somebody will go every 10 years. So does it depend on age or is it just NHS lottery like everything else? And if Antiama is on the call today, is Antiama okay? It sounds like Antiama not to talk. So I'm a bit concerned. And I mean, Antiama Felicia, are you okay? Yes, now please, you can answer my question. Thank you. Hello, Dr. Blessing. Hello, Dr. Akos. Hello, everybody.
Hello. Please, Auntie Amma is okay as a spokesperson. Don't call her out, but she's fine. Thank you. I've answered for her.
Auntie Amma because will be in a man a few minutes in Tinia where Kasa, and I don't want Auntie Amma to keep quiet.
Which Auntie Amma are you asking of, please?
Auntie Amma Felicia, yeah, Debbie, Bibia, or Bema.
Oh, and sorry, sorry. Thank you.
Me pato me wa
how me tie mu pa.
Me who pa.
Oh.
Mama Dr. Kojo Renzi me question do why. Yeah, me have.
Okay, Dr. Kojo, please.
I was thinking that you even answered since you mentioned the
Okay, yeah. So basically the screening is 5 years for everybody up until the age of 60. Not everybody. I think it starts at, like we said, it starts at the age of 25 to the age of 64. So after 64 is you don't really get it unless you request for it. I think there was something about it's being 70 up until 73 as well. I don't know if they've increased the age to 73. Maybe somebody can help. I don't know if you know this one, but before it was 64. But just recently I read something that said 73, but I'll need to double check then get back to you.
I still know the 60. I don't know.
Yeah, okay, 64, fine. So let's just keep at 64. I'll quickly check now and get back to you. But there's nothing like 10 years. And what was the other one she said? What was the other one, Auntie Liz, that you asked? I think it was 2 questions.
The other one, Dr. Kojo answered about Ghana, is it free? Yeah, my come auntie, I'm a pejani, so I bought some pump to any way.
Thank you very much, Auntie Lizzie. Dr. Kojo, would you like to say anything before we close? Any advice?
Hey, Lady Baba, so you mean you didn't see my hand up?
Oh, my apologies.
Make us hear now what miss me. Know what?
Pacha, over to me beside question.
Okay, thank you, Dr. Kojo and Dr. Kuz. Pacha say Obienya 7 a year total hysterectomy 25 years ago. Na onya a year to say when they at the end of the period, well, at the end of period, don't say should I call it a discharge or blood ban? If the person has just seen it, what would you say to this person?
Was it with that total hysterectomy and then what?
Yeah, yeah, total hysterectomy 25 years ago.
And then there's blood bleeding.
Yeah, it's not bleeding. She said like end of period or end of menses.
Like the spotting blood you get, the brown one.
Yes, as at that time, if you see anything like that, to be honest, so far as it's a sporting or it's not something you've really seen, you should probably just go and then find out what it is. Because after total hysterectomy, it doesn't mean, because I know someone who had total hysterectomy and then they had the spot, but the timeline you are giving is a lot, about 20 years ago.
Over 25 years ago.
25 years ago. I'll just say it's a go and then check it because it can be anything.
Like what?
Oh, near to cancer and then different things. It can be different anything at all.
Yeah. I mean, it can be an infection. It can be retained. So even though it's a total hysterectomy, it doesn't mean that they could have retained some of the tissue as well. So it's worth going. Doctor will take a full history. Sorry, Kojo, I've taken over.
No, finish up. I'll just
Yeah, I'll keep quiet. Sorry, you continue.
No, finish. We are now. I can't hear something like. I'll just.
Maybe, just go to.
I mean, it's the same thing though. Yeah. I mean, any vaginal sporting or discharge after it really doesn't. It doesn't require any giddy, but so far as it's a sporting there, what do you need to do? You just need to go and then find out. It can actually be this vaginal atrophy, like thinning of the tissues, like they are now tending to become like smaller. Those can actually trigger bleeding. So if mitma can send but you still need to go and check it because it could be different stuff.
Okay, that's Dr. Kojo.
Yes, ma.
Thank you, Auntie Emma.
Thank you, Lady Baba. Wait, Mamunia. Malisi, maybe you another mention why.
Yeah, the radiasi. Hello, Auntie Emma S26. There's another Auntie Emma, sorry.
Oh, okay.
Baba, good to ask why.
Yes, Patria Darcy.
It's Auntie Liz.
Dr. Kojo.
Yeah.
Yes, so please, do you have any advice for us before we end the meeting?
Yeah, my advice about cervical screening. It's one of the few cancers that we can actually prevent. We know the main cause. We have a vaccine. We have a screening. We can find changes early and then treat them before the cancer develops. So don't die from preventable cancers, and make sure that when you enter a relationship, do the necessary test. It's very important. Thank you.
Thank you very much, Dr. Kojo. Lady Abna.
Oh, yes. Thank you, Lady Barbara, for the lovely, very interactive session. And thank you so much, Dr. Kojo, for your time and being at our cervix today. And thank you, Dr. Kos, and everyone else who asked questions or contributed to the interaction session. Just a few...
Did you say being at our cervix? That's pretty cool.
Yeah, that's what she said.
He actually coined the term himself. I got it from his status. He said, your cervix. I thought that was really cool. That should
Kojo, why are you at somebody's cervix? Married man. Okay, let's continue.
He's at our service. You know, that's a pretty cool term. So I use it. But anyway, yeah. So a few announcements before I let you lovely people go. So tomorrow we've got a time with Taptap Send. It will be planning your retirement with Kofi Poli. I hope I've said the name right. CEO of People Pension Trust. Very, very timely because me self like this. I want to be retiring like next year, so we should start planning our retirement. So please be on tomorrow.
Hey, Lady Abna.
Yes, Auntie. It's good to retire early. So So yes, please do not miss that session tomorrow, and then same time, same link, and then on Friday it is Ask the Lawyer, the Ask the Lawyer session. So please also be sure to join that. And so once again, thank you everyone who has joined.
So next week, next week.
Oh yes, I'll get on to that. But thank you. Like Auntie Amma said, next week, same time, same link. Every Wednesday, you will find us here to bring you the best health topics and advice that we can get. So thanks to the team and thanks to you lovely people for making this program successful. Have a wonderful Wednesday and see you all next week.
Oh, Lady Abner Refi, next week you bear something very nice, a lovely topic in Tina. Everyone should invite a friend.
Yes, we're going to talk about how to grow young, basically, and age backwards. So, for anybody who wants to know how to do that, live longer, age backwards, grow younger, we'll have a pharmacist come in to speak to us about redox signaling and how that can affect your body. So, yes, invite a friend, invite all loved ones, so that we can all age gracefully together like fine wine. Thank you.
Well, thank you, Auntie Emma. Thank you that sorry.
Auntie Emma, make ice cream, Mama.
Apologies for missing that, but you heard it here first. Make sure to join us next week for your session of immortality. So until then, have a good evening. And
you're coming with bars today.
Have a good evening and see you all next week. Bye.
Bye. Bye, guys. Bye.
Until it's about to us one now.
Good night, all.
Good night.